Hi, good evening. I'm Dr. Philip McMillan, and today we're going to talk about an important piece of news reporting because Dr. Anthony Fauci was just recently hospitalized. We're glad that he's okay. He's now back at home, but it was apparently because of a West Nile viral infection. But basically, whenever I hear anything unusual, my first question is around COVID. You could call me COVID hypervigilant. And it's because I know how significant the virus is and critically, how difficult it can be to diagnose. It is extremely subtle. And so if you are not looking for it, you can't see it. So I would accept that I am hyper vigilant. Literally, if somebody came in with what was supposed to be a chest infection, they had a cough, fever, shortness of breath, I give them antibiotics and they haven't responded within 3 days, my next thought is, could it be COVID? That's how my mind works. Anything that is out of the ordinary clinically, I tend to look as part of my differential as being COVID. And so some people would describe it, as I said, as hyper vigilant. But I think this is how we need to be in the context of what's happening around us. I'm going to explain the science behind that and why it is I'm raising this question about COVID in relation to Anthony Fauci, even though he apparently has a diagnosis. As usual, before we start, I want to remind you to join me on COVID protection, the four pillars. Literally, if you click on this, you will get access to a video where I explain some more about COVID storm, the four pillars of protection, giving my personal journey, explaining a little bit more about what's going on. And this is for people who also think that we shouldn't ignore COVID. Now, as I said, some people say it's just a mild infection, it doesn't matter too much. I don't look at it like that, and I'll tell you exactly why I'm looking for COVID storm, and I'll explain it in just a few minutes. This is not anything to be ignored. The fact that the infection number is rising is an indication as to how unusual this virus is. And if you want to understand a little bit of context, just reflect on the fact that we still are not absolutely sure whether or not it was made in a lab. Believe me, if it was, it's not going to behave like a normal virus. Do not underestimate it. This is pretty serious stuff. So let's get back to what was happening with regards to Dr. Fauci. We're glad that he's able to be back at home, but let's look at this PBS news report to get some insight. So it says he's recovering at home after being hospitalized with West Nile virus, a spokesperson said. So this is on the 24th of August, 2024. So just recently. And it shows that he spent some time in hospital after being infected with West Nile virus. He's now recovering at home. He's expected to make a full recovery. As they pointed out, most people don't experience any symptoms at all with this virus, but 1 in 5 can have a fever, some headache, body aches, vomiting, and diarrhea. This is not usually enough to get you in hospital. So he clearly had the situation about 1 out of 150 infected people develop serious, sometimes fatal illness. So the fact that he was in hospital suggests that this would probably be more likely to be the situation. Now, you have to realize, as I said, because I'm hypervigilant about COVID, is that the West Nile virus, it's transmitted by mosquitoes. It's an RNA virus. And I'll show you some images about that just shortly. And as it said, it only tends to cause asymptomatic infection in 80%, and 20% get, or 19% could get moderate symptoms, and 1% end up in hospital. He was in the 1%. So that's what got me to be thinking something isn't right here. And because I'm COVID hypervigilant, my first question is whether or not he had COVID. So the way how it works is this. Many people, and this is from interacting with patients, they don't even think that the symptoms they had were relevant. And I usually am looking for very specific symptoms like fatigue, sudden onset where they were fine the day before and then the next day they were just really fatigued. They may have had a bit of a headache. didn't feel quite well, but they were okay. A few days later, the symptoms seemed to resolve. They're feeling a bit better, but not back to normal. And this can happen sometimes weeks before the incident that may make them come into contact with a clinical person. And because it's so mild, they ignore it. And you have to look for it, you have to dig for it. And so you may have a patient, for example, comes in with very low blood sodium. You can't find a reason. You dig around, it's not their medication, it's not anything else. And you dig in their history and you find that 3 weeks before, they had these kinds of odd symptoms. They got a bit confused in an older patient. And this is the characteristic that can happen in the context of COVID. So it is very subtle. Don't underestimate it. Let's just take you through a few slides just to show you why I think in his case, or I thought that this could have been COVID. First, let's get to the West Nile virus. Now, as I said, it's an RNA virus. And this is a picture of a coronavirus, but the principles are very similar. It uses an entry receptor, just like the coronavirus. It gets inside the cell. It will then release the RNA, and it will then replicate, put together all of the pieces. It will then go out and send off new viral particles. And this is how West Nile operates as well. So both of them use the cytoplasm of a cell to then take over the machinery and get everything done. Typical pattern associated with RNA virus. So, as I said, this is transmitted by a mosquito bite, and this is what they suspect. He got a mosquito bite in his backyard. He wasn't asymptomatic. He didn't have just mild symptoms, but he ended up in hospital. So then my question is well, what are the characteristic of patients who have more severe West Nile viral disease? And in this case, so this is what it would look like here. They tend to be older. He is older than 50 years. Um, they can be immune compromised. And this is what I'm very interested in with regards to COVID. Pre-existing conditions. He could have some of these. I don't think he would have a genetic risk factor. He's certainly not pregnant, at least up to the point of that we know now. It doesn't sound as though he was in any significant occupational or outdoor activity risk, and he hasn't had any known, as far as I know, transplants. So he's older, and the immunocompromised fits with COVID. Now, you may be thinking to yourself, well, why am I talking about COVID and people being immunocompromised? This is why I said you need to understand the science. And when you understand the science, you will treat the disease with respect. Here is how I describe the COVID immune team. This is what it tends to look like. You have your tanks, big tanks, which I call the monocytes, which can become macrophages or dendritic cells. Neutrophils are like your foot soldiers. Your T cells are like your fighter planes. Your B cells produce antibodies. These are like your long range missiles. Your natural killer cells, I call them like your Navy. And your mast cells, this is the histamine releasing cells, is slightly on its own. So, this is what is relevant in relation to a COVID infection. And in somebody who has had a normal infection, this is probably what it would look like. And your immune system is quite sophisticated, especially at the mucosal level. It can take care of COVID infections because it fundamentally is a coronavirus. It is just like another cold coronavirus with exceptional characteristics with blocking interferon and also getting into other cells. So the trick is that as long as your mucosal immune system is adequate and it doesn't penetrate that barrier, it becomes a nothing burger, which is how some people describe it. But you have to be careful because your immunity does fluctuate. Now, the first thing to note in that in highly vaccinated regions where COVID is continuing to circulate very highly, the first thing you have to remember is IgG4. I keep on mentioning IgG4 because it's such an important point. And essentially, what happens, they found it with regards to mRNA vaccines primarily. You tend to produce a number of long term antibodies, IgG1 and IgG3, tend to trigger the immune system. But IgG4, which can be up to 45% of antibodies in somebody who is mRNA vaccinated, are tolerant antibodies, where they tell your immune system not to respond. So, this is straight away a problem in highly vaccinated regions. And this is one of the reasons why I suspect that we are having ongoing circulation of the virus. So, it's very important to understand that I anticipate that this could be a problem. And IgG4 is so significant. You have to remember the numbers are absolutely stunning. This is a almost 4,000% increase in IgG4 after vaccination. This is the third dose. It goes up 38.6 times after the third dose. It is incredible. We've never seen anything like this, certainly not with a vaccine. And it must be because the immune system is trying to tolerate the amount of spike protein it's coming across. So it's quite significant. But it does mean that the immune system is unlikely to respond normally. Now we have to come to the characteristics of this Omicron infection, okay? And in order to understand why this is a problem, you just have to look at what happens with the virus. So here you have an image showing this is an Omicron infection. After the virus gets to your mucosal immunity, all right, you have to remember this is mucosal immunity. This here represents mucus. This is the air, it's in the upper airway. Within 6 hours, Omicron is already replicating and getting across to another cell. Within 24 hours, it has infected all the cells in the vicinity and it's budding quite rapidly. 48 hours, it's spreading quite avidly. Now, what's fascinating is that by this point, you have no symptoms. This is part of the reason why the virus continues to spread so avidly, because many people at even 48 hours where it's spreading around, they still have no significant symptoms other than maybe a little bit of a mild headache, but all of that represents an interferon response. So sometimes they have no response by that time. So when you combine the IgG4 and the fact that in highly vaccinated regions, we seem to be having recurrent infection after infection after infection, this is what you need to now know occurs with your immune system. This is the reality. You have taken out, in theory, you're left with your monocytes and you're left with your neutrophils. But all of the cells behind here, your natural killer cells, your plasma cells, your T cells, are all potentially infected by the virus and become dysregulated. So, this part of your immune system, it's not that it's zero, this is what it appears like. It's not zero, but it is significantly depressed once the virus gets into the bloodstream and starts circulating. Again, that doesn't cause you any obvious symptoms. And this is part of the problem. People don't quite understand that when you have viral sepsis, and that is what I describe around the COVID storm, and so this is what it would look like: virus circulating in the bloodstream, infecting other cells, replicating, circulating, IgG4 maybe binding to it, but it's not getting rid of it, so the virus can continue this cycle. And this process goes on and on. And the question is sometimes, which we don't know, how long does it last for? And this is where I'm focused on, as I said before, the COVID storm, spike triggered autoimmune response mechanism. And that's tied to this ongoing circulation of virus. Very difficult to predict what it's going to appear like and how it will present in terms of disease manifestation. But this is very important. So at this point, if you imagine, and this is why I went back to COVID, it wouldn't surprise me if actually 2 weeks before or 3 weeks before he had a COVID infection, mild symptoms, a little bit of headache, bit of fatigue, nothing out of the ordinary, continues what he's doing. But all the time with the viral sepsis, it's taking out his immune system. And then suddenly he is no longer as immune competent as he was. There's another piece of the puzzle that is very important, and it's to do with interferon. Now, interferon, and this is very, very important. So this is the other part of the continued viral infection. So interferon, this is what it would look like. Inside a not every cell will have interferon capabilities. So if a virus enters it and starts to try to replicate, this cell knows it's going to die. So it warns everybody else, oh my goodness, there is a virus around. So it sends out interferon. The interferon signals to other cells, listen, close your windows, close your doors, don't get infected. Then infected cells, because of interferon, they know they have to die, and it calls in the immune system. This happens with almost every viral infection and some bacterial infections. Interferon gets, virus gets in, interferon is triggered, and it can then get on with protecting the body from ongoing circulation of the virus. This is where SARS-CoV-2 is exceptional. It is probably one of the best at blocking interferon. So this is what it would look like. So here you have now a situation where even though the virus has infected the cell, it's blocking all these pathways, so no interferon is produced. There is no warning. Cells don't die. You don't pull in the immune system. And so this is the characteristic pattern that I am expecting to occur in the context of viral sepsis. So this is why I look for COVID, because I know that it's a combination of two things. One, the immune system with IgG4 could therefore make it higher risk that the virus could circulate. Once the virus is circulating and infecting cells, it is going to be suppressing interferon because that's just what it does. It suppresses interferon responses. When you combine that, when then somebody gets bitten by just a typical mosquito with West Nile virus, where they shouldn't have any symptoms, suddenly, because of interferon suppression, they can't mount an effective immune response. Added on to that, their immune cells are not functioning efficiently. You need your natural killer cells, you need the T cells, you need the B cells to produce antibodies. All of that is therefore depleted, and this is what increases the risk of severe disease. So, this is where people get very confused. They would say, well, he just had West Nile virus. My question clinically is, unless he had a significant risk factor, why would he have such a severe episode of West Nile virus? That's what I'd be looking for. And that's where you would look at the blood test. Is he lymphopenic, which can sometimes happen anyway because of a viral infection? Did he have an excessive elevation of his inflammatory markers? We don't know. All of these things are relevant in terms of how he would have presented. Now, as I said, and I apologize to those people who are not COVID storm focused, this is why I'm focused on the COVID storm. Because the storm is not just about what happens in and around the infection, it's around the fact that once the immune system becomes dysregulated, as I anticipate, it then leads to other parts of the immune system functioning in an abnormal way. That's where I'm looking at the macrophages and so on in terms of the immune system. So it's not just about the infection. The question then is, after the infection, how do we get the immune system to be back in a normal place in preparation for other infections, or even if there was another attempt at the virus to break through the immune defense? That's where the important bit is about storm. And I'd encourage you as I close out, please remember this information is absolutely critical. Four pillars of storm protection. There's a reason why I've put this together, because people kept on asking me. No point telling us about all of this stuff. What do we do? You can't go to you can go to your doctor, but very often the doctors don't know, because I haven't even published the paper yet. Still working on it, trying to put all the pieces together, but it is relevant today to the characteristics of what can happen to people. But you have at the moment limited, if no options, in order to manage these things. This is why I'm putting this together. I want people to be proactive, to recognize that sometimes the responsibility, well, truthfully, your health is your responsibility, lies with you. The more you know, the better prepared you are, the better you can educate those around you. That's what I'm trying to do. Give you the tools that you can make the difference in terms of your life and the life of others. Remember, join us with regards to this process. The more information I get from you, especially when we do our health and wellness webinars, that will then allow me to try and see how the science changes with regards to patient symptoms. This is important information. If it can affect Anthony Fauci with all the resources available to him, believe me, it can just affect anybody else anywhere in the world. It just depends on which virus, which infection you've been exposed to. Let's see how we can work together to find solutions. Thank you.